4, make your way to the ED door. Got 1 in the ambulance bay. Roger.
You can make your way to the helipad. Got Letter 1 inbound.
Copy that. 4-7, go to the orange spot for the rapid response team.
Roger.
I've been with Hartford Healthcare for just over a year and a half now. Now I'm at Bradley Memorial as the supervisor for all 3 shifts. I'm a retired sergeant with the Hartford Police Department. I served 20 years there before retiring. I served in the Patrol Division, Community Response Division, Courts, and finally the Executive Officer. After retiring from the Police Department, I missed that community aspect of the job. Working in a hospital, I get to interact with a lot of people, do a lot of problem solving, assist staff and visitors daily, and that satisfies my desire to, for public service.
Hartford Healthcare public safety officers receive continual training in a variety of techniques and disciplines designed to better prepare them for whatever type of emergency may arise. Whether it be a physical threat or a patient in need of emergency care. This training ensures our public safety officers can perform their many daily activities and duties with confidence and pride. Our officers, dispatchers, and transporters are here 24/7 to ensure our healthcare providers can do their job safely so our patients can receive the best care regardless of the circumstances. Our officers perform a wide variety of services throughout their shift, whether it's conducting door checks, patrolling our parking lots and garage, or assisting a visitor with directions. Our officers are here to provide the best in safety and customer service. They also pass on their knowledge of safety to our colleagues at huddles and assist with difficult patients and visitors when called upon utilizing their skills in de-escalation and restraint. Our new state-of-the-art report writing system allows officers to document the many incidents they respond to throughout their shift. These reports allow us to track safety events and trends so we can better plan our training, resources, and staffing needs. When it comes to public safety resources, none gets more attention than our K-9 partners.
My name is Craig Plant. I am the K-9 Supervisor for Public Safety in the East Region of Hartford Healthcare. I worked for the Connecticut Department of Corrections for 20 years. After retiring, I spent a few years trying to figure out what I wanted to do with the next phase of my life, and was given an opportunity in 2021 to be the first K-9 team in our region. This is my K-9 partner, Remy. Remy has a multifaceted job. So first and foremost, being assigned to public safety, her job is to provide elevated security. She is trained for explosives detection. So our job daily is to patrol and tour our campuses in the East Region. Our ultimate purpose is to enhance safety and security on our campuses. We want to do that in a manner which promotes customer service. We want to make sure that people feel comfortable coming into our hospitals to get treatment. We want the visitors to feel the same way. One of the main benefits of having K-9 teams in public safety is our ability to respond. We're very mobile. We can be requested to go to any campus at any time for any want or need, whether it's perceived threat, to do risk assessments, to even do training, that they have access to public safety presence when they need it because of our mobility.
Of all the resources we have, the most important one is the person behind the badge. Here is just one of the many safety stories of how our public safety officers go above and beyond every day.
I was assigned in the emergency room department, and I observed a lady coming in through the emergency door. She requested assistance with a child that was inside of her car. I immediately notified medical staff who was in triage. Me and the nurse, we immediately reported to the vehicle, and we observed a little baby inside of a car seat having a seizure. Medical staff had checked the child and attempted to take out the car seat. I immediately took off the seatbelt, stabilized the baby's back and neck with my arm, and immediately raced into the emergency room. So when it comes to an adult, a child, or even an infant, we're always willing to lend a hand and to assist medical staff in anything that they need to do. You never know what may occur from time to time, especially when it's a medical issue, but knowing that the child was okay and made it was a huge, heartwarming feeling.
Our public safety officers have grown to become part of the healthcare team, assisting with safety needs and ensuring our patients can receive the best care. Our healthcare providers rely on them on a daily basis.
My name is Valerie Walton. I currently am acting as the nurse manager for crisis units, one at Midstate and one at New Britain. I've been in healthcare for almost 17 years, and it is very different from when I first started. Lots of assaults happening in the emergency room on healthcare workers. Public safety is stationed on our units 24/7, so they do everything that we would do as a staff member. They help us redirect patients. They help wand patients when they first arrive on the unit to make sure there's no contraband or weapons. They help with behavioral de-escalation or any crisis situations that might arise on the unit at any given time. I truly think of them as one of the care team for a patient. They're that integral to what we do.
Safety and security needs are ever-changing with new and increasing threats. The Senior Director of Public Safety and Emergency Management and his team meet regularly with public safety managers and directors from each region to collaborate on projects, share ideas, and standardize processes for public safety across the system.
Hartford Healthcare is transforming care, and Hartford Healthcare Public Safety and Security is innovating the way that we do our work too. We are a best-in-class public safety and security resource to make sure all Hartford Healthcare colleagues are safe and secure. It's an unfortunate reality that the environment continues to escalate inside of healthcare. We know as a healthcare organization we need to change and innovate and grow to make sure that we're taking care of our colleagues and our patients and making sure that they're safe. No longer are the days where we're just focused on our acute care hospitals, but our pre- and post-acute settings as well. From the medical group, to rehab network, to our behavioral health network, and everywhere in between. We're thinking about this work differently. We're adding more cameras, more access control equipment, panic buttons. We never rest within public safety, and we want to move as quickly as possible to make sure that we add those best practices into our work. Learning just inside of the state of Connecticut isn't enough. And while we work with the Connecticut Hospital Association, we're also leveraging national best practice from the International Association of Healthcare Safety and Security Managers to ensure that we're on track and we're further than others inside of this important work.
My name is Frederick Paquette. I work with the Hartford Healthcare Neighborhood Health Team. I started as a soldier of the United States Army. From there, I evolved into the East Hartford Police Department. And from there, Hartford Healthcare, where I am now today. What I like about it is the unit itself. Yes, my title is Public Safety Officer, but I'm a Public Safety Officer for the Neighborhood Health Team. What I like about it is the fact that you're actually going out on the street. And with my experience and skills as a community outreach officer, it blended really well. I'm not sitting in one spot. Every day is a different clinic area. We set up, we serve the public, which that for me, creating a small impact within the community. And great team.
What our public safety officers do is absolutely noble. What they do are guardians to this organization. We're so proud of each and every one of them, and we're so proud of all the Hartford Healthcare colleagues that have that questioning attitude to make sure that we can keep this organization safe.
Because your safety matters.
Because your safety matters.
Because your safety matters.
La seguridad tuya importa.
Because your safety matters.
Because our safety matters.